This turned my stomach when I heard it during Prime Minister's questions on Wednesday.
Mr. Speaker, two members of the same family in my constituency recently suffered serious health problems. The NHS was there for them, as you would expect, and they're both hopefully now on the road to recovery. But the recently departed honourable member had a different idea, that we should have an insurance-based health policy, an American-style policy, and that family, whose cost would have been $1.2 million, would have been crucified financially by what happened. So will the Prime Minister take the opportunity to say that our principles on the NHS are that it's universal for everybody, that wealth does not give you privileged access, and that this is a public service, not a private service?
Prime Minister.
I'm deeply sorry, sir, about the case that he raises. We are the party of the NHS, and we will always fight to ensure that it remains free at the point of use. Mr. Speaker, we inherited an NHS on its knees, but we are seeing progress. Waiting lists are down. Patient satisfaction is improving. We got the best ambulance response times for half a decade. There's much more to do, but we're delivering the investment that's needed, and it was opposed by who? The Tories and the now departed Reform.
Do you think he was telling the whole truth? Waiting lists may be shorter, and so may ambulance response times, but do we get a timely service? And can the NHS really be free when we have to buy so much of our healthcare separately from the tax we pay for it? Oh, it's still legally free at the point of use for most core services. That hasn't been abolished. But the reality on the ground is that access has been eroded so badly that free often means unavailable. And what good is that? The gaping hole in dentistry, look at that. Dental care is the clearest failure of the NHS today, and it's due to a Labour policy. The 2006-2007 dental contract brought in under Tony Blair's government. That system pays dentists through units of dental activity, UDAs, which effectively cap how much NHS work they can do while making complex cases financially unattractive. The predictable outcome has been dentists leaving NHS work in large numbers, practices refusing new NHS patients, and entire areas, like the county of Powys, where I live, becoming what campaigners call dental deserts. I personally am on a waiting list for a checkup and may be waiting for years. By then, who knows what might need to be fixed and how much I might have to pay for it, because NHS dentistry isn't free at the point of use, is it? A service that exists only on paper or after a multi-year wait isn't meaningfully free healthcare. It is deferred or denied care. It's still nominally part of the NHS, but in many places it is functionally gone unless you pay privately. And isn't that the point of the process, nudging us into private healthcare by the back door because successive governments won't fund a public service properly? But it doesn't stop there. Prescriptions in England are another contradiction. Patients pay a flat fee per item unless they are exempt, which means treatment is not free at the point of use. Meanwhile, prescriptions are free in Wales and Scotland, so a free NHS is already a postcode lottery within the UK. Then there's access to GPs. Officially free, yes, but increasingly hard to obtain. Long waits, triage systems and 8 a.m. phone scrambles effectively ration access. When patients can't get appointments, many turn to private GPs, meaning they end up paying to access what is supposed to be a universal free service. Hospital waiting lists are another fault line. Care remains free if and when you get it, but millions are stuck waiting months or years. In that gap, again, those who can afford it go private, Again, the system hasn't formally introduced charges, but politicians like Keir Starmer have allowed delays to create a two-tier reality. Social care is an even starker example of the gap between rhetoric and reality. Unlike NHS treatment, it is means tested. Many people, particularly the elderly, end up paying thousands of pounds for care or selling their homes. Politicians blur the line between health and social care when defending the free NHS, and the reason is clear. Even eye care and hearing services are only partially covered. Eye tests and glasses require payment, unless you qualify for exemptions. Hearing aids are available on the NHS, but long waits push some people into private providers again. The pattern is consistent. The principle of a free NHS still exists, but access is increasingly restricted, and where access fails, private companies rush in to fill the gap. The system is now formally universal, but practically conditional. Starmer is relying on a narrow technical definition. If some services are provided free by the NHS, it is free at the point of use. It means he doesn't have to bother with whether people can realistically obtain that service in a reasonable time. And he doesn't have to face the reality that while the NHS hasn't been openly dismantled, it has certainly been hollowed out.